Sure. I think preventing lice it's challenging because you don't always know if someone has lice or has nits because they can be very small. Um, if someone has an active case of lice, then avoiding physical contact as best as possible is probably the best way to prevent it. But treating people who are affected, and probably most importantly, treating their close contacts at the same time will prevent lice from spreading outside of a specific affected group. Generally, the rule is if I were to see a patient in the clinic and diagnose them with a lice infestation, I would both treat the patient and recommend that everybody that lives under their roof of all ages, even people who are not symptomatic, be treated at the same time and probably repeat treatment again in 1 to 2 weeks to ensure that not only is the active infection treated, but that the nits that may persist and survive the preliminary treatment are also treated. And that has a lot to do with what is perceived as treatment resistance. Often resistance to treatment is more about not treating everybody who has an infection at the same time, and so you get recurrence in the same patients, but it's not because they have a persistent infection as much as they have been infected again by somebody who's a close contact who wasn't treated. Sure. So still the first-line treatment for lice is a medicine called permethrin, is the generic term, and there are a couple brand names that people would be familiar with. But it's usually used as a cream lotion, and people are asked to apply it and leave it on for a period of time. Typically, the instruction is put it on before you go to bed and wash it off in the morning, something like that. And then that actually will kill the lice and many of the nits. Again, you try to get everybody in the same group to do it at the same time so that their treatment is coordinated, and that gives you your best chance of getting it out of a home or a group of people. There are, in fact, sort of the super lice that you referred to. There certainly are lice that are resistant to permethrin and don't respond very well to that treatment. And there are some other, I wouldn't necessarily say newer, but other treatments that are used, something specifically called malathion, and that's a very effective treatment, but we are very careful with malathion because it's flammable. And obviously, you have to be very careful with your instructions when you tell somebody to put something on their head that could catch fire. So yes, we use malathion for situations where we've used a permethrin application and it doesn't seem to be working, but we're always really careful to tell people how to handle it so that they don't put themselves at risk for other injury. Yeah, I think it's just about resistance. So I think when a person talks about super lice, they're talking about drug-resistant lice. And like any type of infection, be it a bacterium or in this case a human parasite, certainly those living things that reproduce can adapt over time to treatments and become harder to treat. And that certainly has happened to some degree in lice, but I think the majority of lice that we encounter are still susceptible to the first-line treatment, which is permethrin, which is a little bit safer in terms of not being flammable and those things. So what I have encountered in my experience is that there is sometimes confusion between recurrence being a resistant louse or lice and being something that the person has been reinfected because there wasn't an approach to treat everybody that they were in contact with, which generally works pretty well. Yeah, be careful with mayonnaise and Vaseline and other sort of home remedies, things like that. There is, it's not hard to find advice where people will say, well, you can suffocate the lice by doing this or doing that. And although there probably is some anecdotal evidence that those things can work, the medications are much more effective and safe when used properly.